Welcome to Rogers TV's COVID-19 local update for April the 8th, 2020. Over the next half hour, we will bring you the updates on the pandemic in the area. I'm Anandi Carol Woolery. With the new emergency orders given by the provincial government, police forces are starting to become increasingly involved in the COVID-19 prevention efforts. We spoke with Constable Darren Fisher of the Stratford Police Service about the enforcement.
So the City of Stratford is following the provincial emergency order, which states that people are not allowed to attend specific outdoor recreation facilities, including playgrounds, sports fields, skate parks, off-leash dog parks. And this also includes park benches, picnic tables, and shelters within park areas. So with that, those places are restricted for anybody, and people are not to be attending those locations. Further to that, there's the business closures, and if you need to find a list of the essential businesses that are able to be open, you can check the ontario.ca website, and that can help you with that information there. There's certainly no set amount on that. Everything would be looked at on a case-by-case basis. Right now, the Stratford Police is looking at taking an educational approach to this situation. So we're hoping to work together with the community in educating everybody regarding the safety and well-being of how to keep yourself safe, right? Staying away from these areas is paramount. But we can work together to let people know what the requirements are. And right now, this approach is working really well for us, and that people are staying away and people are working together to do that. Yeah, if you do have a concern, then you can call us. It's not an emergency, so call us at our non-emergency number. That is 519-271-4141. Right now, I think the citizens of Stratford are doing really well, though. I'm not aware of any 911 calls that are coming through to us. I'm sure other places are having a problem with it, though. Yeah, what we've done is created policies and practices that encourage our officers to wear personal protective equipment when they have the chance to engage with the public in a more personal format. So all of our officers and all of our cruisers are equipped with surgical masks, safety glasses, and latex gloves. So our officers are encouraged to wear those items when in contact with the public. And that's not because our officers could be sick or because the person that we're dealing with could be sick. It's just to help prevent any spread of illness from going any further. I think the best advice is to listen to the advice that's being given by all of our health professionals right now. Stay home, wash your hands as frequently as you can, keep your house clean, and practice social distancing.
The township of North Dumfries is under a state of emergency during the COVID-19 pandemic. We spoke with Mayor Sue Foxton about the situation in the township.
So, we've declared a state of emergency. So we have the EOC, Emergency Operations Center, meeting twice a week. And we discuss the next things we're going to follow up with throughout the week and things we're going to check on. So one of the things was trying to find people to deliver groceries. So I contacted our churches work together in North Dumfries. So and it's called the Ministerial, and it's all the churches coming together to do events together and work together. So I contacted the Ministerial and asked if they could find volunteers for delivering the groceries, and they've stepped up amazingly. See, what you do is when something like this happens, a lot of people that are really active and energetic, all of a sudden have to be still. Now, I've always said if you want to punish a person that's a doer, don't let them do. So they are really interested in volunteering and helping out. And this is true at the regional level. The region, I sit on the pandemic committee at the region, and they have the volunteer action committee, and people are volunteering, but nobody's calling up and saying they need the volunteers. So if you know of businesses out there or volunteer groups, not volunteer groups, but not-for-profit organizations that need help, if they could reach out to the Volunteer Action Committee, this Volunteer Action Center can connect the volunteers to them. So that's one of the things we've started to work on. We're working on trying to get people to reach out through their phone or Skype or Zoom or whatever and talk to each other. Share a laugh or share a joke, or talk about how things aren't going quite the way you wanted them to go or expected them to go. The strain's starting to take hold. And then on top of that strain, there's the conversation about the masks. Masks sound like a great idea, and they really are, except for will people become complacent? Will they think the mask is the safety they need and take further risk? And if they do, instead of blanketing the curve, we will escalate up the curve, and that's not what we want to happen. So I'm for the mask, but I'm also for people realizing it is not the way to solve or resolve this situation. It is just one extra tool in the toolkit. We get to set out certain rules and regulations within the township. Our bylaw becomes legal, they can enforce them. And we also call upon resources. So everyone is working on how to get through this pandemic. Well, basically we're following along with the other municipalities, the 7 municipalities. So it's a social distancing, it's the closure of our parks, it is preventing gatherings. And so our bylaw goes around and makes sure everybody's doing what they're supposed to do. And they have the ability to ticket. So I'm trying to get a virtual men's breakfast, a seniors coffee hour, trying to figure out how to do bingo where people could make up their own cards and anybody in the group would take their turns doing the numbers, things like that, getting games and getting interactions. You know, we talk a lot about children, and we talk a lot about seniors and moms, not as much about males, because the men make it less known, but I think they feel the strain just as much because they want to be doing. And haven't heard a lot about teens, how teens are managing. If you get a chance, I'd like you to maybe look at that graph showing the impact by age group, because it's quite shocking, because actually people over 60 are now among the smallest. And it's hitting I believe the teens up to the 59-year-olds, the most. And that's exactly the opposite of what we thought would happen. Now, maybe the incline will happen with all the deaths within the nursing homes. And that's quite sad. I wonder if we should actually step in at some point. The government would have to step in and say, no more wards. See, most nursing homes have 4 people to a room or 2 people to a room. And maybe we need to get away from that. I'm not sure how we do it. And people are wondering how we would staff it. But again, there's a lot of those volunteers out there. So maybe that's the thing we should be looking at to next. I think people have the misconception that we're doing okay. As I said in another online video, we're at war. This is a world war, and our fight is against a pandemic. Never before has our world been in this situation. We've had to self-isolate and to draw back from our society. And we have to do that now. And we're just at the peak. And how people react in the next 2 weeks will either decide that it'll be upward bound or whether we will start to blanket the curve. So they have to understand the next 2 weeks are critical, and possibly even the next 3 weeks. So please, please hold on to those restrictions. Remember social distancing, wash your hands, isolate. The masks are wonderful, but they will not save us. What will save us is keeping to the rules and following the regulations. Try and be patient. Understand this is 3 weeks in a lifetime. It's not your whole life. So let's do this so that we can all survive it together.
Jaya James is the Executive Director of Lakeside Hope House in Guelph. Rogers TV producer Jan Hamilton speaks with her about their newest partnership with the Community Company and the Collaborative Wellness Project pilot, helping our most vulnerable population through this time.
Good morning, Jaya. Thank you for doing this. I wanted to say Hope House has certainly long served our community in caring, compassionate ways, but things are different now. So what is it you're doing to move forward?
Thanks, Jan. We're really excited to be able to update the community, and things have changed, like for everyone else, quite a bit in the last few weeks. So starting on March the 27th, we actually went to grocery delivery, and that was a big change for us. So prior to that, with all the COVID-19 protocols, we'd shut down the cafe, we'd shut down our meal programs, and kind of worked in partnership with Royal City Mission and the Drop-In Center, the Seed, Chalmers, Wyndham House and Salvation Army to kind of organize those things a little bit more focused to help make sure we were up to the highest COVID-19 protocols. And so our real focus moving forward is our food market and making sure that food insecure people have access to groceries. And so starting on March 27th, we started to deliver to homes. And this week is our first week doing all the deliveries of individuals we could catch on the phone, because we can't always get people right away on the phone. And we're doing our deliveries to their house. We call them a few days before their scheduled appointment. We take their order over the phone because it's really important to us that we maintain that approach of letting people select the items that they want. We have to then pack all the groceries, and then we've been so blessed that Linamar has been providing the drivers, and their drivers know how to do delivery really, really well. And so they come in, they pick everything up, and they deliver it to all the homes. And the feedback we've been getting as we've been calling community members has been great. They've been really thrilled, and this allows us to help support people in remaining self-isolated or practicing their social distancing, depending on what they're doing.
How can we help? What can we do?
So I always love this one. How can we help? And I think that to me, the first thing people can do is take care of your friends, family, and neighbors. If we are, checking in on our friends, family, and neighbors, using the phone or text or, yelling across the street at each other from like really good distances, we're going to know when someone's in trouble or needs help. So we'll know if our neighbor is maybe just not feeling well, and it may not be COVID-19, but if you're not feeling well, you're supposed to treat it as if it is until you know the results. And so you can go and pick up their groceries for them, or you can make sure that that they're still checking in with you each day, just especially if they're on their own. So if they get their health starts to decline rapidly, someone's there. And the other piece is to me is that if we take care of our friends, families, and neighbors, it allows all those other support systems that we have in place to serve those who are the most vulnerable. And we, if you're encounter someone who needs more support than you're able to provide, just know that you can reach out to Hope House and get a grocery delivery set up for those individuals. You can reach out to, if it's even with mental health, we have a partnership with 5-Star Relationships where after we have a phone call set up with you to make you a community member, we can get you connected. You can do phone counseling or Skype or online counseling, depending on what technologies you have available. And that's how our community is going to grow, and it's how we're going to become a more generous and caring community. And crises are terrible. Nobody wishes this on anybody. But I have to say, humans have this amazing ability to rise up and care for each other in crises, and we have seen that in huge, huge spades.
Well, thank you very much, Jaya. I really appreciate you taking the time to talk with us today, and good luck and continued support of our community.
Thank you, Jan. It was my pleasure. And if anyone has any questions about how to access any of our services, we're going to be posting those up on our website today. So it'll have details, and it's very simple, but you can read it there.
Ontario Green Party leader Mike Schreiner speaks with us about the current situation in Guelph and what efforts need to be done in the city to help us through the pandemic.
Well, I've been really proud of Guelph as a community, just how people have really come together to help each other, to support for each other, to care for each other. One of my stories that really inspired me was a few weeks ago. I received a call from a doctor saying, we may have had our first positive test for somebody in the homeless community in Guelph. And that was on a Friday. And by Sunday, the community had really rallied and was finding solutions for people who were unhoused to have a place to self-isolate. And I just thought, that just shows a community that really rallies and cares for its most vulnerable. I've been inspired by how many businesses who've reached out to me here in Guelph to, make ventilators or make masks or to make hand sanitizer. Somebody yesterday reached out about, hey, we can do, industrial strength washing of medical clothes and things like that. So businesses are really stepping up. I've had so many individuals. I mean, we had a Zoom fundraiser the other night for Guelph General Hospital that somebody organized, and it was like a gala dinner via Zoom. So I that's been really inspiring in what is an incredibly challenging time. And every time I go to the grocery store in particular, which I try to limit my trips, but just the opportunity to say thanks to the frontline grocery workers and delivery drivers, transit drivers, shelter workers, the people who are doing those essential businesses that keep us fed and care for us really deserve our thanks. And so that's been inspiring. In terms of the provincial government, I think the thing that's impressed me the most is just how all the parties are working together to put Ontarians first. And I've been saying we need to quarantine partisanship and really work together to help people and make sure people have the supports they need. And in general, I think the government's done a pretty good job. I mean, obviously, I don't agree with everything they've done. I wouldn't be an opposition member if that was not the case. And part of my job is to hold government accountable. And I would say the three areas I'm most concerned right now is just making sure that our healthcare workers in particular and care providers and like long-term care facilities have the personal protective equipment they need. I know that's a huge concern, across the province, across the country, around the world. And so that's something I've been really pushing the government on. And I think they're going to need to set aside more money. When they first released the mini budget, I was right away was like, we got to double what you set aside here for personal protective equipment. The area I've been most disappointed in the provincial response so far is rent relief. I know I've talked to many tenants, and whether it's individuals, families, or small businesses who are deeply concerned and highly anxious for April 1st rent, and that's come and gone. And now we're looking at May and even into June, and a lot of people really stressed about how they're going to pay their rent. And that also affects landlords too, because I'm talking to landlords who need that rent money to help with their cash flow and to help them pay their bills. I know a lot of homeowners are concerned about their mortgages as well, and my hope is the banks will defer those payments for people who need them deferred. We know the federal relief is going to be rolling out soon, but I felt the province could have stepped in and really provided emergency rent relief for individuals, families, and small businesses. Other provinces have stepped up and done that. Ontario should have done that and should do that as well. And then an increasing concern for me is just the mental health issues that arise from people physical distancing and feeling more isolated. Certainly hearing concerns around potential increases in domestic violence and things like that. And so just making sure that we have the supports and services in place for people when it comes to addressing, like physical health, but also mental health. Yeah, so I think the biggest thing that is that that I'd love people to know is that all parties are working together to put the people of Ontario first, and we're all working hard to make sure that we address people's concerns. And I would say the biggest complaint that I've heard from people is around the availability of personal protective equipment for healthcare workers and care providers, in places like community living or in our long-term care facilities and retirement homes, et cetera. And just to know that I'm working really hard to push the province to make sure we have adequate supplies of PPE. And I think the province is working on that. I think the second one is the concern people have really raised is rent. And again, for individuals, families, and small businesses. And that's probably the issue I've been the most disappointed in the province's lack of response. I think the province has the fiscal capacity to have a rent relief fund put in place to alleviate the concerns that people and businesses have in terms of paying rent, landlords have in terms of their cash flow. And then finally, the thing I'm going to be really pushing the province on, and they have allocated some additional money for mental health supports and services, but I think people are going to need more. And so as we sort of look at what's the next kind of relief package going to look like coming from the Ontario government, those are the three areas that I'm going to be the most focused on. I've been a strong advocate for basic income. And the federal government we're almost there with the federal government. And so it's been interesting seeing them respond and working with my federal counterpart, Roy Longfield, and just being able to, talk about what I'm hearing, what people are telling me, and have those lines of communication open, I think are really important.
The region of Waterloo held a press conference Wednesday morning at 11:30. Here are the details.
Before I talk more about our situation overall, I'd like to point out some things about our dashboard. One, due to the volume of cases, our dashboard numbers are current as of 7 p.m. the evening before. That's right up at the top when we talk about the dashboards. This does not mean the work stops at 7 p.m. Our hospitals, our long-term care homes and retirement homes, our public health staff, and all our partners in the healthcare system continue to work around the clock. We are continuing to work on managing cases and outbreaks. Anything that comes in after 7 p.m. the evening before will show up on the next day's dashboard refresh. So just to let folks know, the dashboard is not a real-time tool for reporting. It is meant to keep the community informed on the trends that we are seeing. And just quickly about the new epicurves, like all curves of this kind, there is typically a 1 to 2 week delay between when someone starts having symptoms, when they are then diagnosed, and then when cases are reported to us and then added to the dashboard. Therefore, the epicurves are dynamic, and the data for the last 1 to 2 weeks will continue to be updated on a daily basis. We have now bolded the explanation we had previously put about that dynamic nature of the curves underneath the curves, so that it will be more easily seen by people so they can understand. Now I'm going to go back to speaking about our overall situation. So in particular, I'd like to talk about the long-term care homes. So we are continuing to see more cases in long-term care and retirement homes, and more homes have at least one case. This is what we expected. It continues to highlight that this is a more vulnerable population to COVID-19, and it also highlights the importance of continuing the strict measures that have been put in place for these homes, as well as for the community. All that we are doing in the community also helps decrease the risk. to these homes. Now I'd like to talk a little bit about the upcoming Easter weekend. So as we approach the Easter weekend, it's a timely moment to remind us all of the need to stay at home and to continue to use physical distancing when we are outside of our homes. We know these are the most effective means to slow the spread of COVID-19. Easter is the time when many of us come together with our wider families, but we can't this year. Each of us will continue to have a personal role to do everything we can to slow the spread of this pandemic. So I'm asking all our residents who celebrate Easter, please only celebrate with members of your immediate family, those who are living in your household, and please check in virtually with other members of your family. This will be especially important. It will be especially important that we do not relax our physical distancing measures during the Easter weekend. Any relaxing of our measures will subsequently lead to more cases than we otherwise would have had, and a more rapid escalation of severe cases and deaths. In conclusion, I know the social measures that we have put in place are difficult and will only become more difficult in the coming weeks. Without those measures, we would have experienced an exponential, uncontrolled rise in cases, and our healthcare system would have been overwhelmed. The measures have prevented many more severe outcomes and deaths than we would have otherwise had. I sincerely thank everyone who is doing all that they can. While we need to continue these efforts for some time, I would like our residents to know that your efforts have made an impact, and everything we continue to do will impact and determine our future. Thank you.
Rogers TV will have COVID-19 updates as they come out. Stay tuned to Channel 20 to stay informed about the situation in the area. Thanks for watching, and we'll see you soon. Stay safe.